Good afternoon, everyone. Thank you for joining us for this Nurse Digest session. We're going to explore utilising digital health tools during telehealth consultations. My name is Margaret Dempsey from APNA, and today I'm joined by Hina Bamani from the Australian Digital Health Agency, who's going to deliver the session. Welcome, Hina. APNA and the Australian Digital Health Agency would like to acknowledge the traditional custodians of the lands across which we meet and pay respect to elders past, present and emerging. And I'm coming to you today from Wadawurrung country in Victoria. Now I'm going to pass over to Hina for today's session.
Good afternoon, everyone, and thanks for joining us. And I'm joining you from the Gadigal People's Eora country. Now, what I was going to cover today is basically a summation of some of the digital health tools that you've covered in your previous Nurse Digest sessions. So some of the things that you've already covered so far is things like getting digitally health ready. You've also covered electronic prescriptions and helping your patients understand them. You've looked at how My Health Record can be used with the COVID vaccine, and you've looked at the new active script list functionality, which is now available in electronic prescriptions. So like I said, what we'll do today is look at how all of these digital health tools, as well as secure messaging, can be used when you are involved in a telehealth consult. So now I'm sure most of you are not new to telehealth, but just like any other patient interaction, having access to your patient's health information can save you loads of time, and it can clearly help facilitate decision making. So, accessing your patient's My Health Record even before the telehealth consult can provide you with information that you wouldn't otherwise have access to. Now, think of all the times that you've had to chase, for example, a pathology result or a hospital discharge summary for your patient, and how much time that actually involved. Now, during a telehealth consult, I'm going to assume that that would become even more challenging because you don't have your conventional methods to be able to get, or you don't have access or easy access to those methods to get that information. So what type of information can you actually find in that My Health Record when you're getting prepared for a telehealth consult, or indeed during a telehealth consult? So let's look here at the different types of information that you can find in My Health Record and where they actually come from. So there are actually 3 different sources for the information in My Health Record. Now, the first one I'll cover is from Medicare. Now, what happens is once you activate a person's My Health Record, what will flow in is MBS and PBS claims data. You'll also have in there any organ donation information, but really most topically at the moment is the Australian Immunisation Registry, or AIR data. Now, like I said, that information will flow into your patient's My Health Record as soon as it's activated or triggered, and it flows in with 2 years of retrospective information. So really what that means is when you do access your patient's My Health Record, you should be able to, at the very least, see 2 years of retrospective Medicare information. Now, the second source is from healthcare providers themselves, so people like yourself. So what we're looking at here is anything like a shared health summary, a hospital discharge summary, medicines information. So we're talking about prescription and dispense information. We're also talking about pathology reports and radiology reports, just to name a few. Now, the last source of information that you can find inside My Health Record actually comes from the patients themselves. And that's because My Health Record actually provides a space where patients can upload information to their own My Health Record, and in fact their own health notes. They can put in, for example, if they're taking aspirin, which is not something that's going to come across because it wasn't prescribed or dispensed in their medicines information, and that's just an example. They can also enter details of any of the person they want contacted in a case of an emergency. And they can also upload something called an advanced care plan, which is basically a document that outlines end of life decisions in a situation where your patient can't articulate that information. So it is really a valuable space or source of information within the My Health Record system. Now, let's just take a look at some examples of those types of information that you can find in My Health Record. Now, the medicines information overview is a fantastic overview where you're going to find all the medicines information within your patient's My Health Record, all extracted and presented to you in one place. And this becomes really valuable because it means you don't have to look in various different documents. So for example, if your patient is discharged and they are prescribed a certain medication, in that discharge summary, that information will be pulled from that document and put into this view. So anywhere in a patient's My Health Record, and again, I'll return back to that example of your patient putting in aspirin in their own personal health notes, to that extent that even their information or even their medicines information will be pulled into this overview. And what's great is you can also see any allergies or adverse reactions that the patient has in this particular view, and it will list all of the patient's medications information all in that one list. And you can click on, if you can see there is a hyperlink to where the source document is, where that information was extracted from. So again, going back to the example of the aspirin, you could actually click on there would be a hyperlink to the personal health summary, and you could actually go to the source document where that medication information came from in case you wanted to get some more granular information. So the medicines information overview is probably one of the most popular views that people access or providers access in the My Health Record system. Now, there is now a brand new overview that's just recently been added to My Health Record, and it's called the Consolidated Immunization View. And now what you can see here is an example or a screenshot of that view. And in this view, you can easily see your patient's immunization status, and you can even see when the next immunization is due, which you can see in this particular example would have been the 2nd of April. Now, this view, like the other overviews, it actually, again, extracts all immunization information, including from AIR, which is the Australian Immunization Register, and from any shared health summary or even an event summary, and again puts them there in that one single view, making it easier for you to see your patient's vaccination status and, in fact, when their next immunization is due. So this is something I'm going to imagine is going to become a very popular view, or because it is new, I can imagine that this is going to get a lot of viewing from healthcare providers moving forward. Now, like the medicine and the immunization overview, there is what's called the pathology report overview that, again, pulls all of the pathology reports into one place and presents them in a view where you can sort by any one of those column headings, including the test name or test type, or the organization that conducted it. So, sometimes where it was done, but you don't remember the name of the test. So you can just click on that, and then that will help you find it. So it's a great way to find out if there is any pathology reports in your patient's My Health Record and to easily get access to those pathology results. There is, again, a similar overview for radiology, but it's called the Diagnostic Imaging Overview. And again, you should be able to see diagnostic imaging reports in a similar fashion. Now, thinking about how you normally try and gather that information that we just discussed, for example, the pathology information, pathology reports, or medication information, having access to them through your patient's My Health Record, and I'm going to say particularly during a telehealth consult, where it would be, like I said earlier, it'd be really challenging to get it through the conventional methods. And this is definitely, I think, going to save time and energy for both yourself and other practice staff. Now, with the value of this information being available to all healthcare providers, I think it would be worthwhile finding out if your practice is actually connected and contributing, so that the information for your patient is not just available to yourself, but to all healthcare providers involved in your patient's health journey. So we've looked at My Health Record and how it can help during a telehealth consult. Let's look at how electronic prescriptions can also be, incorporated into that consultation. Now, previously, and we're talking about, that the initial stages of the pandemic, there was an interim measure in place where practices were allowed to send an image of a prescription via a fax or an email to a dispenser if they were seeing their patient, through a telehealth consultation. Now, since then, there has been the advent of what's called electronic prescriptions. So now we have a far more secure and an efficient option where a QR code is sent to your patient's mobile. So, and you can see examples of that and how it would look on your patient's mobile device on this particular slide. Now, that first image shows how it would look in their list of messages. And then the next image is when they actually open it up. And, from your perspective, I think it would be great. What would be really great is to check that your patient has actually received that. Now, I'm talking about, I guess, the nurse practitioners that are on the line, or if you are there when that prescription is prescribed to your patient, to make sure that the patient has actually received it, because it is an instantaneous process. And how often do you find that your patient hasn't updated their latest contact details? So, you've got an old mobile number on file, and in which case, this particular prescription is not going to go to their mobile because their contact information was actually out of date. So it is pretty good practice if you're able to check that the patient has received it at the time of the consult. Now you can see there that the token will have some information on it, like you can see there the drug name. It also shows the quantity and the number of repeats, and that's so that the patient can identify the QR code or the code that is associated to that particular medication so that they know what it matches. But you will also see that it doesn't actually have the patient's full name or any other details, but that is all available to the pharmacist once they scan the code, okay? Now, the token can also be sent as an email instead of a text message. And this slide shows you exactly how that would look if you were to do that, if you were to take that option, or if your patient was to take that option. Now, what's worthy of note is that the email that is sent through this system is actually secure. And what I mean by that is it has appropriate encryption, and it's not like the normal emails or faxes that are often sent from practices. It actually has a higher level of encryption, so it is a lot more secure. And while I'm here, I might just address one of those, one of the communities of practice questions, which I will be going through at the end as well. But there was one in particular that was to do with QR codes. And I'll just add that, yes, the QR code can be printed, and it can also be sent via SMS. So you can have the code sent to you both ways. But obviously, once it's been dispensed, that particular token will then become inactive. Okay, so you couldn't get it dispensed twice because you've got it on two different methods. So that's worthy of note. And any repeats should then default to whatever the last method that you or that your patient has nominated. But again, what you would need to do here is, if it was given to you via a printout, and that's not what you wanted, or that's not what your patient would have preferred, then they need to have that discussion either with the provider that prescribed it, or with the dispenser who's dispensing. So either with your doctor or your pharmacist, and let them know which method they actually prefer. Now, having a look at whether when a token is cancelled. So this is what happens when a script has been cancelled. The token becomes invalid, and here you can see examples of how that's going to look on their page, on their mobiles, in the different situations where we're looking at either the script has expired, it's already been dispensed in that second one, and lastly, it was cancelled by the provider or the prescriber. Now you can clearly see what's missing is the QR code, and that's because it's no longer valid. It's just going to display the relevant message associated with the reason for the cancellation. Now, given your telehealth consult has been so digitally enabled, why not take it that extra step and use secure messaging, which is a tool that'll allow you to send any of your patients' information to other healthcare providers securely. So what is secure messaging? Really, all it is a tool that makes sure that any data that you send that you transmit to any other healthcare providers is encrypted, completely encrypted from the point that it leaves you, and it remains encrypted all the way until it finishes that transmission process and arrives at whoever you're sending that information to. So, if you're sending a referral, for example, to a specialist or to an allied healthcare provider, then that information remains secure all the way through the process. Now, the benefits of using secure messaging include the fact that your associated healthcare providers are receiving that clinical information for your patient in a timely fashion. But not only that, it's paperless and it ensures the privacy of your patient's results. So now that we've had a look at some of the digital health tools that you can utilize during a telehealth consult, I was just going to go through some of those questions that were raised since the last Nurse Digest session in the communities of practice. Now, really, it's so great to see there were so many fantastic questions that came through the community of practice. And I'm just going to take this opportunity right now to go through and address some of them. There were a fair few questions surrounding immunization information in My Health Record. And like I referred to in the presentation, there is that new view that shows your patient's immunization information. And like I said, it does extract any immunization information available in your patient's My Health Record, including from AIR data, as well as any other documents, like, for example, a shared health summary or event summary. So if, for example, another healthcare provider has done a vaccination and they've put that information into an event summary, that will also be pulled into that immunization view. Now, but what we do need to note, actually, while I'm here, is to let you know that while My Health Record does pull that information from AIR and presents it to you in that immunization view, what it can't do is upload information to AIR from My Health Record. So, for example, like what we just looked at, if a healthcare provider did enter an immunization into either an event summary or a shared health summary, while that is visible to you through the My Health Record, you cannot then try and upload that into AIR. You'd have to upload that into AIR via the normal or conventional means that you would upload any immunization information into the Australian Immunization Register. There was a question about newborns and My Health Records. So when parents or any authorized representative for the child registers a newborn for Medicare, My Health Record will automatically be created for them. But what you do need to know is that they can, at that time of registration, they can indicate on that registration form that they don't want a My Health Record to be created for the child. So there is an option to opt out, so to speak, at the time of registration for Medicare. Now, there was another question that related to not being able to access discharge summaries in a particular My Health Record. Now, what I will say is, though, while most hospitals are registered and connected to the My Health Record system, there are still hospitals that are at various stages of that uploading process. So even if you don't find a discharge summary, you still might see the pathology and radiology results from your patient's hospital admission, or vice versa. So for example, Queensland Health, they do actually upload the pathology and radiology information, but you may not find a discharge summary. So don't give up at the fact that you haven't found the discharge summary. Have a look and see if there's any other reports that are up there, because like I say, they are in various stages of uploading information. There is still a lot of work happening in the space. So like I say, just it's worth checking the My Health Record, but it's also worth having a look at our website, where we have a list of all the organizations that are connected and uploading to My Health Record. Now, this is the same thing that applies to private pathology and radiology practices. And again, this is a space where there is a lot of work underway, and we're hoping to see more and more private laboratories connected and uploading. Now, in situations where you access your patient's My Health record and you don't find any Medicare information at all, this could be, like I said, when I alluded to the Medicare information, I did say that, you know, you need to actually activate or trigger a person's My Health record before that information flows in. And what does that mean? That just means that when you, as a healthcare provider, the first time you click on your patient's My Health record, if nobody else has ever accessed that record, that information hasn't flown in yet. So basically, what you need to do is either refresh your browser, or you can exit the application and then return, and hopefully that information would have had the opportunity to flow in. So that's one of the reasons why you may not have seen any Medicare information when you do access your patient's My Health record. The other reason could be that your patient has actually actively chosen to restrict that information being displayed, because a person can actually go into their My Health record and choose which documents they want displayed. And there is actually an option to switch off Medicare information being available to other healthcare providers. So that might be the other reason why you haven't seen the Medicare information in your patient's My Health record. Now, what I thought was fantastic is it was great to see that some of you are actually uploading event summaries when you're performing procedures like IUD insertions, because that is an absolutely fantastic, it's a perfect reason or opportunity to upload an event summary. So well done to whoever's doing that. Typically, shared health summaries don't contain any procedural information, so it really is the best way to go, putting that information, if you are the person that's uploading, putting that procedure information into an event summary and uploading that. Again, if you have got previous pathology results for your patient and you think it's relevant to other healthcare providers, in your patient's healthcare journey, that's another good reason or good opportunity to upload an event summary where you can enter that information. Because having event summaries with a clear synopsis are really valuable documents. So I really do encourage you to continue uploading event summaries, because you're doing a great job. Because me seeing those as examples shows me that you know exactly when an event summary should be uploaded. So that's fantastic. Now, was there any other questions, Mark? Because I've gone through all the ones that I found through the communities of practice.
Thanks, Hina. That's been such a great wrap up, and it's great that there is that community of practice where people are asking each other questions. There was a question raised at the last Nurse Digest that we said that we would clarify, and that was about multiple medications on e-scripts and relating to medication per token. So can you confirm or clarify that, please?
Absolutely. Thanks for that, Margaret. Absolutely. So the way an electronic prescription works, or an electronic script, is you can have multiple medications on the script, but each medication will have its own token. So you cannot have a token that will cover more than one medication. So a script can have multiple medications and thereby have multiple tokens, but you cannot have a single token that will cover more than one medication.
No, thanks very much for clarifying that. And feel free to the audience to pop any questions into the Q&A section on the bottom of this screen. I do have another one now asking about pathology companies, and it's about QML, Queensland in particular, but creating electronic pathology because of course it saves so much emailing, faxing and posting, and telehealth appointment situation would be really convenient. So do you know when QML or other pathology companies will get on board with electronic pathology?
That's a really good question, and we can. There is work being done with Helius, which is the sort of parent company that QML is under, and hopefully we will see some progress in that space eventually. But at the moment, Helius is not connected or uploading to the My Health record system. So that's a space to keep your eye on, hopefully in the future.
Yeah, good, thank you. Another question that has come into the chat: do patients get another QR code generated once it's been dispensed by the pharmacy?
That's a very good question. And yes, absolutely. So usually what happens is where where the patient goes to get their medication dispensed, they will then provide the patient with a repeat QR code. Now, what can happen, so I have heard that they can sometimes print that out and give it to the patient, but it's really the patient's preference, and they should be able to say, I would like that sent as a text message to my phone, or alternatively, I'd like that emailed to me, or yes, please give me the printout. So this is an option and a discussion that you would have with your pharmacist, or for the patient to have with their pharmacist if it's not given in the mode that they prefer.
Good, thank you for that. There's no other questions at the moment, but I've got a couple of comments that I'd like to make from listening to your great presentation today. One is about the quality of data at your practice, and of course we all know about data cleaning. So I just want to say that it's actually, you know, all these sort of initiatives are a whole of practice and a whole of organisation team approach. So it shows the importance of the role of your admin staff with updating contact details. So like you were saying earlier, Hina, if the organisation has an incorrect email or an incorrect mobile phone number, then the information's not going to go to where it should be. So that's a great role for your non-clinical staff to be updating patients' contact details when they come in all the time, or just checking that they are the same, because some people that can change. And my other comment is that I encourage you, the audience watching, to become digital health champions in this sector, to be able to educate others. Hina was saying, you know, not all hospitals are on board at the moment. Have conversations that are opportunistic when you can, and become the digital champions in your area to help drive this forward.
Absolutely. And if you do need any more information or support with My Health Record, you know, feel free to use any of these links and phone numbers or contact details that are on this slide. These slides will be made available to you. So definitely reach out to us and we will help you in the best way that we can.
You do provide a great level of support. Thanks very much to Hina and the rest of the agency team. I would like to let you know that this ends this current session of this current series of Nurse Digest. So I'd like to thank you to Hina, and also to Tram Doe and Nicola Graham, who also supported previous Nurse Digest presentations. So thanks everyone for joining us today. Stay well. Bye now.
Bye.